हेलो एवरीवन। आज के द्रोणाचार्य सीरीज की शुरुआत कर रहे हैं हम लोग। तो डॉक्टर ज्योति मलिक मैम को हम इनवाइट करते हैं। ओवर टू यू मैम।
Thank you so much. Thank you, Roshanji. And welcome everyone to this new incredible Gynae Forum. So, this NIGF Forum has 10 states, and our president is Dr. Ragini Agarwal. And with the blessings of our patron, Dr. Sharda Jain ma'am, I would like to take blessings of our NIGF president, Dr. Ragini ma'am. Can I have her short CV being displayed if we have that? रोशन जी आप मैडम का सीवी एक बार दीजिए।
नहीं, कोई सीवी नहीं होगा, सिर्फ डॉक्टर कमल बख्शी मैडम का सीवी होगा। इसको डेक नहीं दिया गया है।
नहीं, आपका होना चाहिए।
रोशन जी
मैम आज
एक्चुअली मैम ने मना किया है। चलो आई थिंक वी विल टेक ब्लेसिंग्स ऑफ मैम। दिस इज फॉर एवरीबडीज नॉलेज, दिस इज द द्रोणाचार्य सीरीज है जो हम ये NIGF में शुरू कर रहे हैं। और द्रोणाचार्य जैसे कि नाम हमें डिपिक्ट करता है, इट विल बी द टीचर्स ऑफ टीचर्स हु वुड ग्रेस दिस प्लेटफॉर्म, who would impart their knowledge, their experience, and from that experience, from that past, what we learn today, and how we imbibe those experiences in our practice is the motive. I think that Dr. Ragini ma'am has thought of that and started this particular series, जो हम महीने में एक बार करेंगे. So I would now request Dr. Ragini ma'am to give more insights into the NIGF and into the series before we move on to our special guest, or maybe not even guest, our Dronacharya today. Our Dronacharya today is Dr. Kamal Buckshee ma'am. We will come to her once we take blessings of our president, Dr. Ragini ma'am.
Thank you, Jyoti. Thank you so much for your kind word. Very good evening to one and all. और सबसे पहले मैं नमन करना चाहूंगी मैडम कमल बख्शी को, और बहुत बहुत मैडम हम आपके ये शुक्रगुजार हैं जो आपने हमें ये समय दिया। मेरा ये मानना है कि हम बहुत कुछ खास करके अपने मेडिकल फील्ड में अपने सीनियर्स से सीखते हैं। उनका जो एक इमेंस एक्सपीरियंस है, उससे जो हम सीख सकते हैं वो हमें कोई भी किताबी ज्ञान नहीं दे सकता है। इसी बात को ध्यान में रखते हुए ये पर्टिकुलर सीरीज मेरे दिमाग में आई कि इसको हम शुरू करते हैं, जिसमें कि हमारे जो टीचर्स हैं जिन्होंने अपने इतने वास्ट एक्सपीरियंस से और बदलते हुए समाज में बदलती हुई मेडिसिन की सारे इसको देखा है, किस ढंग से चीज़ों में चेंज आया है। और जहाँ तक मैडम बख्शी का सवाल है, हमें सबको मालूम है कि वो हमारी NIGF की गाइडिंग फोर्स हैं और शुरू से ही उन्होंने हमारे को एक मार्गदर्शन दिया है। और मैडम ने बहुत सारी चीजें फर्स्ट टाइम हमारी OBGYN में शुरू किया है। ज्यादा मैं ज्योति को फिर से इनवाइट करती हूँ कि वो आगे इसको चलाए।
थैंक यू मैम। बहुत ही एक अद्भुत और एक सुंदर सीरीज निकल के आएगी ये, और मैं बहुत एक्साइटेड हूँ ये सीरीज को करने के लिए, क्योंकि मुझे पता है टीचर का रोल क्या है आज के समाज में। आज से पहले भी जब से ये आई थिंक सृष्टि बनी है, तब से एक गुरु और भगवान दोनों एक ही समान, एक ही लेवल पर, बल्कि गुरु का दर्जा हम भगवान से भी ज्यादा देते हैं। तो उसी भावना के साथ हम इस सीरीज को शुरू करेंगे। रोशन जी मुझे PPT आप स्टार्ट करिए, मैम का CV दिखाइए।
एक सेकंड।
So redefining gynecology, एक बार पहले मुझे फर्स्ट वो भी दीजिए, फर्स्ट बैक करिए। तो बैक, हाँ कोई बात नहीं। Yesterday's wisdom, today's science, tomorrow's vision. तो बहुत ही they are beautiful words which make a lot of sense, and that is what Dronacharya means. The Dronacharya speaks from their wisdom with today's science, how we can make use of that for our vision for tomorrow is the essence of this series. And today being our Dronacharya guest being Dr. Kamal Buckshee. Next, please. Ma'am has been the former professor and head of Department Obs and Gynae, AIMS, Delhi, a premier institute. एम्स जब हमें नाम सुनने में आता है तो हमें पहले से ही लगता है कि दे आर द क्रीमेस्ट of the cream of doctors that the AIM has produced, and ma'am has been the head of department of this institute. She has been the emeritus professor, National Academy of Medical Sciences, India. She is the first president of FOGSI from Delhi in 1995, and also the first president of ISOPAP Delhi from 94 to 96. Ma'am has got the Dr. B.C. Roy National Award for the Eminent Medical Teacher. She has Lifetime Achievement Awards from AIMS, FOGSI, ISSRF, ISAR, IFS, and so many other bodies. And also she is the recipient of Senior Scientist Award by WHO in 1972 on fetal maternal unit study by Stockholm from Sweden. So, ma'am, she is 50 years ahead of time. What we are doing today in our fetal-maternal units, ma'am conceptualized it in 1972, more than 50 years back. She has been also first time in India, the obstetrician performed plus started a ultrasound-guided fetal blood sampling, the intrauterine transfusion, skin biopsies, and all this was created. The Department of Fetal Medicine was created at AIMS, Delhi. And then many courses on ultrasound were started, on in vitro culture of cancer cells to detect the best drug was done under her guidance, and using various treatment modalities for the PCOD patients. First time she was being the obstetrician. As an obstetrician, she was an examiner for her DM endocrinology, for DM genetics, and for PhD in reproductive biology. Ma'am has been the WHO consultant to Bhutan, Geneva, Sri Lanka, Nepal, Bangladesh, and has been nominated to participate in various international conferences and has delivered keynote guest lectures at these countries. And she has been the advisor to Government of India on technical matters in OBGYN. She has been scientific advisory committee for ICMR and has more than 250 national and international publications. Not only that, lots of community work and a community education has been imparted by ma'am. Next, please. So we will quickly see the best teachers. They teach from the heart and not from the book. Next, please. Next. So teachers, so we can see so many pics of ma'am in so many conferences, getting so many awards. And they say teachers who love teaching teach students to love learning. So that is this teacher that has done all this magic of making people love the learning part. Next, please. So again, we can see ma'am's so many pics, her surgeries, the conferences, the CMEs that she has done, the degrees, the awards that have been conferred on ma'am. Next, please. So better than 1,000 days of diligent study is one day with a great teacher, and that one day is today. So I would just ask a few very interesting questions, ma'am, from you. That what inspired you to become a doctor? And then on top of that, what inspired you to become a teacher? And who were your mentors? Because we want to know your mentors also, because you are a mentor to so many mentors. So I would go to you, ma'am. You can please unmute yourself and answer those questions before we go on to other next questions.
Good afternoon, everybody. First of all, I would say, dear Sharda ji, I wish to congratulate you for really starting the NIGF and for spreading it across the whole of Delhi. And I wish to congratulate our brilliant star. And who's that our brilliant star? Dr. Ragini, the president-elect. Now, today I would like to, as you beautifully share, that I would like to share some of the experiences for the youngsters, because as far as youngsters are concerned, they are the cream of India. Now, as far as you asked me the question whether you wanted to become a doctor, I never wanted to become a doctor. I wanted to be an artist. I was very fond of painting. My father didn't like it. Then I said, I want to be a lawyer. He says, you will all be the time talking, and men don't like women to talk, Those days, it is the men. Even still, as far as the men dominate the world, but as far as the women, they are the one who give birth to the men and the women, Then it was only one day, when I saw a patient, who lost his mother, and the way he was crying, and the little baby that was born, the mother dying and the baby. I felt so bad that he has come to this world. Who will take care of him? And that is what motivated me to become an obstetrician and gynecologist as far as that is concerned. Now, coming as far as the obstetrics is concerned, I always felt India is number one. We are no way behind. So I always used to think that we must progress just like at the Western world. And that is why whether it was in utero transfusion, whether it was a fetal medicine, whether it was as far as plastic surgery. Now I'll give some of the examples to the youngest children, Few years back, a patient walked into my clinic, the mother and the daughter. The daughter was about 14 to 16 years, and the mother was very sad. The mother said that she's posted for surgery tomorrow, and we have come to you. Now, my daughter, about 2 years back, today she's 14 to 16. When she was about 12 years old, she had a cyst in the ovary. The surgeon and the obstetrician tried to remove the cyst. And while removing the cyst, they removed the ovary only of the left side. Now, this poor girl had only one ovary, and she was posted in one of the major hospitals of Delhi. And she came to me that she's for surgery tomorrow. Now, looking at her when she walked down, I told the mother, don't take my name, but postpone the surgery. And you get the thyroid test done. To my utter surprise, you know what was the report of the thyroid? TSH was 325. Now, to hear TSH value, we normally say 10, 20, 30. Here it is 325. So this was from the Lal lab. Then there used to be in our time Australian lab. So I repeated from the Australian lab, and it came out to be 360, higher. Then I said, now it will be a biased opinion. I'm liking Australian and not liking a Lal lab. So I chose a third lab. So there is no biasness. And the third lab that I chose was this, the third lab, again, the Indian. And it said that it is again 380. So thyroid level was very high. Now, since the thyroid level was very high, I started the patient on 20 milligram of Thyronorm every day. And I said, you come after 2 weeks. When she comes after 2 weeks, my goodness, the ovary size had already regressed by 25%. So she continued on Thyronorm, and as far as the cyst regressed and the ovarian tumor disappeared. I published that article just for the sake of the postgraduates to know that as far as our country is concerned, thyroid is very important and it should be tested. And this patient was being taken for surgery without the thyroid test. Then there is a second patient again, very interesting patient as far as this second is concerned. Now, this patient who came to me was a doctor and a gynecologist, and who was pregnant, and she was 9 weeks. Her first child was about 10 years, and this child fell down and had a head injury. Now, after the head injury, the child didn't cry. The second child was only about 1 year old, and this child went running in the winter season and got the rod heater. He burnt his hand and the child didn't cry. One, the hand burns, doesn't cry. The other falls down, doesn't cry. The poor mother said, now this third child which I'm having, is this child normal or abnormal? Now, in order to see that whether this child is normal or abnormal, I told her that you come to institute. She came from Madras and we did her ultrasound guided. I said, I will have to do skin biopsy. So I performed ultrasound guided skin biopsy. The moment I performed the ultraskin biopsy, the baby did not move the hand. Normally, whenever I did any procedure, the baby is first one to take my biopsy forceps away or the needle. And that is why I started later anesthetizing the patient, because that the baby doesn't interfere with the work, And this baby had no sensations, So in that case, we sent for histopathology and the report came abnormal. So advise the mother that your baby is not normal. It is up to you to decide. She went back to Madras and got her pregnancy terminated. Now, the third case, again very interesting. This patient roamed to all the hospital. She was the VIP sister, She came with a fibroid uterus, which was about 34 to 36 weeks size. And she wanted a myomectomy, but every gynecologist told her that your uterus might have to be removed because it is a huge size while doing a surgery. She says, if my uterus goes away, my marriage is gone and I will be abundant, I do not want to have a hysterectomy. So with this patient came to me. Now, it was already 12 days of the periods. So what I told this patient is that you come on the 5th day of the period. Now, to my utter surprise, this lady comes and says, my pregnancy test is positive. Now, 34 to 36 weeks of size of the uterus and the baby lying on the top. How will I do this termination of the pregnancy? The big question in my mind. So I told the patient, all right, I'll admit you and I'll tell you in the morning what I'll do. My postgraduate said, ma'am, what are you thinking? I said, let me sleep over and think. And in the morning I decided, I said that in this patient, that most of the times in our patients whom we think that had a deformed bole or choriocarcinoma, we give methotrexate. So let me give methotrexate in the sac instead of giving KCL or the other. So I gave the methotrexate in the sac and discharged the patient. Patient कहती है आपने तो डॉक्टर साहब कुछ करा ही नहीं है, खाली एक निडल डाली है. मैं कहा बेटे तुम मेरे पास 2-3 hours, you come after 2 to 3 days. She comes after 2 to 3 days and brings the products of conception to me. Now this patient aborted. I said, I cannot operate you because unless 2 to 3 months are over, you have just had a pregnancy, because myomectomy cannot be done when you have just delivered, Then this patient later, I did myomectomy in her. She conceived and had a baby. And I was very happy that this patient conceived and had a baby, So these are very interesting various cases, Then there have been patients of malignancies who have been coming to me. And then in those cases again, we used to take the cells. I, along with the Dr. Chapekar, used to test against the combination of the various chemotherapeutic agents to see which drug is better. This was as far as the oncology is concerned. Then there came a patient, and she had all the burn marks in her body. I said, Bete, aapke ye burn marks kaise aaye? She says, my in-laws wanted to kill me. They poured kerosene oil over me and I was burning. And with my shrieks, the neighbors came around. And it was the neighbors who banged into our house, and they saved us, And it was these neighbors then, they brought this patient to me in the AIMS, Then in her case, I did an IVF, she conceived, but the poor girl aborted when she was only 4 weeks, So these are the various experiences that I have had over the years, And what I feel is that the youngsters of today, their clinical knowledge, their examination, as far as the history is concerned, and everything that they must do is to be very carefully, because unless we are careful, so I would say, combine your clinical knowledge with the latest advantage, merge them together and move forward in line. Because nowadays we have artificial intelligence, we have so many labs, new tests that are being done. But without the good history, without the clinical knowledge, you cannot advance. And without the latest advances, we cannot go further, And to add further, I would say that as far as we obstetricians are concerned, the innovations in the 21st century are transforming as far as our science is concerned. But we, obstetrician and gynecologists, must integrate our personal clinical knowledge, history, everything with a high technique. And with these, I would say, Jai Hind. If anybody has any query, they are most welcome. Thank you.
Thank you so much, ma'am. Thank you. That was really, each and every case or every case scenario that you have narrated has a meaning. And it gives so much insight into that particular disease. Maybe it adenomyotic or a uterus with such a big fibroid, and medical management of such pregnancies, or maybe it your fetal skin biopsies, establishing the fetal medicine department, or may it be thyroid disorders. So I think you are an encyclopedia, I suppose, of such cases. And over years in AIMS, you have witnessed such difficult cases which have been tackled so very casually, coolly, and so very nicely. And I think your idea of just sleeping over and thinking and coming with a new insight next day is something so very interesting, and so very one should follow your on your footpath. So what do you think exactly? Have you felt any change in the way the young practitioners of today's practice and how you had been practicing in your times? What remarkable difference, because you have a daughter who is as beautiful as you and who's as intelligent as you. So how do you guide her? And indirectly, how would you guide all of us? What differences do you think have occurred over time? Your comments, ma'am.
My dear colleague, as far as the youngsters of today are concerned, the patients of today are concerned, and my daughter, everybody is very different. Now, coming to my daughter, she's very highly skilled, very honest, truthful, and she has not only done MD, she has done DNB, she has done PhD, she has done so many post-graduation from as far as UK is concerned, MRCOG, and she's got FRCOG also, and she was in Singapore, many places. She's a very honest, sincere. What I would say, every gynecologist and obstetrician must read the latest, and unless they see the latest and combine with the clinical sense, they'll make best. They are wonderful. But what is shocking is, like even yesterday, the patient came to me, and what she does is, the first thing is she puts the ultrasound report there. They think ultrasound will diagnose everything. I said, बेटे पहले ये तो बताओ कि आपका प्रॉब्लम क्या है बच्चे, आपका नाम क्या है, so that you know to make her comfortable and to see the symptoms and other. And then, you know, I realized as far as this patient, first she didn't even tell that she had one abortion, and she had that abortion when she was only 8 weeks. So I said, what did you do? She says, DNC was done. And I said, was the histopathology sent? She says, I don't remember. Now look at the patient who's so casual in her life. So I said, would you like to conceive now? No, I will wait for another 4 or 5 years. And her weight was 80 kg. Her husband's weight was 120 kgs. Now, though both were very chubby, now I really didn't know how to very nicely, politely, I said, okay, as far as your diet is concerned, your schedule is concerned, your exercise is concerned, and I guided them and told them to do certain investigation, because she had not done anything, whether it was a kidney function, thyroid function, or the blood group, or none of those things that she had done. All that she had was an ultrasound that she got it done. So the patients also need a little patience. They need to present what they have. The obstetrician and gynecologists of today are very intelligent, and my hats off to you. And I think we learn from the youngsters of today.
Thank you so much, ma'am. I think staying with the young keeps you young, I suppose. So you can imbibe a lot of things that the new Gen Zs and Y has to give us. And you can gain from your wisdom, from your experience, and from the technology. I think we can all improvise in our serving the patient as such. So do you think the technology has impacted us in a good way or a bad way? Or how do you feel at your time, since you were more of clinically, you were judging the patients based on history and the clinical examination. And as you said, these days we just straight away jump onto the investigative part. So what message would you like to give us, all of us?
I agree partly with you. In our time, like when I was I had become a lecturer, I found the deficiencies in our science, you know. So what I did was, because the ultrasound wasn't there, so the ultrasound people brought a machine, you know. So I kept that machine which they had brought, you know. It was an old, heavy machine. And what I did was, I gave to the 2 postgraduate 2 theses. One, to have the norms as far as the fetal, as far as the head is concerned, legs are concerned, as far as the body is concerned. So that was my first postgraduate. Abedhon, the second postgraduate, I said, now you do as far as the ovulation is concerned. See that when does the ovulation occur? Second, is it the right ovary only, or right ovary or left ovary, alternate or what? So you do on that aspect. So they did it. And then this is the way that we gave various theses and guided, you know, to see how the science can advance. And it was so nice that even when I was just a junior, just a lecturer, from all units, the doctors would come together and to witness that what are the latest advances. So one is the ultrasound machine, which we took from the company, then started the work, as far as this is concerned. Then when I got the ultrasound machine for myself also, we bought it from the department. Then I started, as I told you, that ultrasound guided techniques that I started. Then there was the biopsies were so expensive. So I used to go to the workers, and my husband, who was an engineer, I devises the needle, to make a biopsy, fetal skin biopsy. Then the needles to aspirate, again, they were very expensive. So devised many instruments also. And I would say I learned gradually. My biggest teachers have been my patients.
Ma'am, we have
gradually.
मैम हो रही है
इधर से ऑन कर हेलो
जी मैम आप ठीक है
Ma'am, we have some teachers. I could see Dr. Manjupuri ma'am there among us. So, ma'am is another great teacher. So, ma'am, would you like to would you like to ask something from Dr. Kamal Buckshee ma'am? रोशन जी, डॉक्टर मंजूपुरी मैम को अनम्यूट कर दीजिए.
मंजूपुरी मैम नहीं है
नहीं है क्या? अच्छा, she must have left because 2 मिनट पहले मैंने देखा था तो I could see her. Okay. So, what do you suggest? Any messages that you would like to give us in the present scenario? We are doing a lot of good work, but we are still scared of the law, the PCPNDT law and everything. So what message would you like to give us, the youngsters of today? How do we take care? The ART Acts is there, Surrogacy Act is there, PCPNDT, MTP Act. We feel scared because though we are doing everything good and doing a transparent work, but still the small little mistake may make the life so very difficult. So what suggestions do you give us so that we can do a better practice in our today's scenario?
You have asked a very good question. Even I these days am scared. Now, why scared? If I am in the OT and if I click a photograph, it is objectionable. I can be taken to the court. So what I'm trying to say, we have to be very careful. We have to observe the PCND Act. We have to observe the rules that govern us, because we cannot take chances as far as that is concerned. But we must have our good history taking. We must read the latest journals. We must see what are the do's and the don'ts. And I think if we take precaution, I'm sure we can advance the clinical knowledge, and the latest advances are like the right and the left hand moving together. And so the knowledge combination and with the previous things and working hard with the latest, we can progress,
Ma'am, I think one last question from me. If you have to start again today, what would you like to do differently? If you had to again restart your medical career today, would you like to do anything different from what you have done over these years, or you would go the same way that you have done?
It's a very good question, because as far as I am concerned, I've always felt, that the path that we move, we should be very careful, because we are dealing with human beings. Now, I'll give you a very nice example. One of the villager came and he brought a big canister of ghee, and his daughter-in-law was pregnant and there were 3 babies, So he says, because my daughter-in-law has 3 babies, look after her very nicely. Look at the innocent man. So what I feel is respect your patient, and because these are the patients who teach us every day. So if you want to learn from the patient, a good history taking and examination. But at the same time, you must be aware with the latest advances, what are the things that we need to advise, It's not an easy task. If I were to take up Obs and Gynae, I would not take it again because it's very demanding. I would rather go on to various other fields which are less demanding, To be an obstetrician, you need to know medicine, you need to know gynae, you need to know surgery, you need to know so many things, endocrinology, pregnancy with diabetes, there are various things. My hats off to the youngsters. I admire you. You are knowledgeable, you are beautiful in your mind, action, and what you do and you tread. But be familiar with the latest advances. That is very important. Be familiar with the rules, to protect yourself. I think I admire you all because you all work very hard.
Ma'am, would you like to again become a lawyer or an artist or an obstetrician? Between the 3, what would you choose today?
I think I would like to become a lawyer. And I'll tell you why I become a lawyer. A lawyer came to my house long back when I had become an assistant professor. And he told me that one of his clients, somebody, had done something wrong. And he says, you give her a certificate that he's perfectly right. He was the son of the HOD of one of our department professor. I said, बेटे, तुम इधर से ही मेरे घर से निकल जाओ. मेरे से गलत काम कराने के लिए मेरे दरवाजे का डोर कभी खटखट मत करना. Honesty is the best policy. So I feel, I don't say lawyers are not honest, but lawyers are the one who are privileged with money, privileged with time, privileged with everything. But the results are not according to what they are. So I would like to become a lawyer if given a second chance.
So thank you so much, ma'am. I think it was a great insight to know more about you. We know Dr. Kamal Buckshee, ma'am, as the HOD of AIMS, but we did not know the woman behind this name, and so many things we could know from this small interview that we had. And I think because you said you would like, you have given us only 35-40 minutes, we thought it would be the best way to have more know about you. How can you keep updated even at this age?
Oh, I love to read at night, Peter.
Okay, still you read at night?
Yes.
Okay.
Because without reading, there is no life, Even now, what the latest journal of ours has come up only today, it came by post. So I was just shuffling the pages. What is new it has written.
So that is something we all have to learn from you. That every day has to be a day of learning. And when we go off to sleep, something new has to be added to this system, to the mind, and something positive. And how can you dress up so very gracefully?
I have to go somewhere just now. And that is why I said, because the time would be very little, because I have to reach a place about 30 to 35 kilometers away from my house. So I wouldn't get time to dress up. So I dressed up for the occasion where I'm going, and at the same time to meet you young, beautiful ladies, to meet Ragini, to meet everybody. It has been such a treat. I tell you, dear, you're wonderful. God bless you. It has been a treat to interact with each one of you.
Thank you so much, ma'am. I would go over to Dr. Ragini for her final words, ma'am, before we close the session.
Thank you so much, madam. ये दिन एक ऐसा दिन है, we will cherish this all memory, all this guidance. And रोशन जी, मैं चाहूंगी इसको रिकॉर्ड करके और हम इसे सारे ग्रुप्स पे कल तक डिलीवर कर दें, कि जिन लोगों ने नहीं ज्वाइन किया है कि उनको मालूम तो पड़े। एक छोटी सी चीज मैं यहाँ शेयर करने चाहूंगी। पहली बार मेरा जो एकेडमिक एक्सपोजर था, मैडम जब एम्स की हेड थी, उनके अंडर में आइसोपार में ही हुआ था। सो आई थिंक मेरी जिंदगी की जो ट्रेजेक्ट्री है वो भी कहीं ना कहीं आपसे शुरू हुई है, और सच में इतना अच्छा लगा है सब सुन करके, और थैंक यू सो मच। और यंगस्टर्स को ये बात याद रखनी पड़ेगी कि बिना पढ़े, बिना समझे और बिना आगे गए आप वो नहीं बन सकते हो जो हम लोग देखते आए हैं। थैंक यू सो मच मैडम फॉर योर गाइडेंस एंड द वर्ल्ड ऑफ विजडम।
Thank you, Ragini. Lovely. And my Betty is my biggest teacher. You are another teacher. So I would say I love you all. You people are such hardworking and very nice.
Thank you, madam. Thank you. Thank you.
Thank you so much, ma'am. Thank you, Dr. Kamal Buckshee, ma'am. हमारे द्रोणाचार्य जो आज के रहे, मुझे लगता है कि शायद जिसने नहीं मैम को आज सुना, कुछ मिस किया होगा, और इसीलिए हम नहीं चाहते कि कोई कुछ
नहीं करने देंगे, आप भेजेंगे सबको।
हम सबको ये रिकॉर्डिंग भी हमारे ग्रुप्स में आएगी, so that everybody can learn from whatever pearls of wisdom that ma'am has given. So thank you so much, Dr. Ragini ma'am, for this brilliant idea. Or I think we every day we learn, and you are again a brilliant teacher that I look up every day to learn something from you, and from everybody. I think we can, from each other, we keep learning. So enjoy this every day. Each day of life is precious. Live life to the fullest. Live life like Dr. Kamal Buckshee is living. Keep learning every day, keep reading, and stay up to date. So that should be the mantra of life. Work hard, study hard, party hard, love hard, and always just keep yourself very humble, so that God can keep blessing you each day. So thank you so much. We have received so many wonderful comments, and many comments we have received from Dr. Anita. Very nice life experiences shared. Respected Kamal ma'am, brilliant blessings. Dr. Savita Tyagi saying thanks ma'am for the blessings and regards. And again, still few more messages, but I think because of the paucity of time, I think we cannot take comments here. So we would like to wind it up. And thank you, Roshanji. We wind up and we give the recording tomorrow in all the groups. Thank you so much. Thank you for joining.